If I had to define quality of life, I think it has to do with overall well-being. I think we think about it in terms of your physical well-being. Are you able to move? Are you able to sleep? Are you able, and then are you able to do the tasks that you need to do, your daily living tasks? Also, we think about your emotional well-being. Are you depressed? Are you anxious? Are you feeling good? And we also think about quality of life. We think about side effects, physical symptoms. These are all areas, when we think about quality of life.
I have a family that I still need to provide for. I need to be able to work full time. So quality of life to me is, in large part, being able to go to work. Right? Seems like a simple thing, but I need to continue to work to earn a salary. I need to have time with my family. I mean, you do realize cancer diagnosis changes your priorities in life.
That quality of life is being able to work. It keeps my mind actively engaged so that I'm not thinking about my cancer every day. If I retired, sat there and watched soap operas and thought about how horrible life was, I probably wouldn't be around for very long.
Impediments to that can sometimes be pain. Even with pain medication, sometimes that can make men so tired or just mentally foggy that the time that they're spending with their families isn't as good as it could be.
We really talk to patients about what's important to them and try to maximize their quality of life by pairing a treatment that will have side effects consistent with what they want in terms of quality of life directly. It's a very personalized conversation and decision, matching each treatment with each individual patient.
You make decisions based on, okay, I want a long life, but at the same time I want a quality of life. And so I call them the two Qs, quantity and quality. And I want both.
So men with advanced disease, oftentimes what we're looking at is quality of life for them. So sometimes we'll reach a point where we're not able to cure them of their disease, and we want their time to really be high quality, where they can spend time with their families and things like that. Sort of focusing on their goals and writing sort of that last chapter in their life as we see that maybe we aren't able to cure, but what do you want to do? And oftentimes people have very concrete goals. I want to get to my daughter's wedding. I want to see my son graduate. And we try and focus on those goals and see how can we get you there, feeling the best you can so you can really enjoy these life experiences. And I think when people have something to work towards, it really helps them. And really refocusing them on, it's not just about the quantity of life we're given, but the quality. If someone could live for 100 years in pain all the time, I don't think they'd want it. But if you can give them a year where they're highly functional and can do what they want to do, that's of great service. And I think a lot of men, that's what we try to focus on as we get towards that.
I have 10 grandchildren, and I want to be with them. I want to see them grow and be to their events and to be part of their lives. And so that is a big thing to me as family.
There are prostate cancer patients out who compete in triathlons, who run marathons, who, work all day as a soldier doing things, outside, physically demanding tasks. And there are prostate cancer patients who are retired and who, work in their tomato gardens, and quality of life to them is important so that the grandkids can come over and they can play with their grandkids. It's just based on everybody's phase in life and what they want to do.